Morning. Yeah, my name is Fat. I'm a hemorrhagic stroke survivor, and today we do have Dr. Arryn Gamble on. So she is a board certified neurologic physical therapist, and she's had a ton of experience. And I did want to welcome her on the show today. She's going to be talking about how to regain movement after a stroke. And so, without further ado, I'm going to welcome Dr. Arryn Gamble and have her introduce herself.
Hi, everyone, and hi, Fat. I'm so excited to be on live with you and for you to, kind of welcome me into your Hope for Stroke community. So I'm super excited to be here. As Fat said, I am a board certified neurologic physical therapist, and I specialize in treating stroke. I'm a certified stroke rehab specialist specifically. I treat Parkinson's, concussion and brain injury, many issues pertaining to dizziness, and I'm also a board certified MS specialist too. So, around the whole gauntlet of neuro. I operate out of North Carolina, and I also treat virtually through my company, NeuroPathways. So you can find me online on Instagram. I run a pretty interactive Instagram account, and I'm always posting fun exercise interventions as well as just some general education, a lot geared towards concussion.
Could you
Um,
tell us a little bit about the neural pathways?
Sure. So
Yeah.
I do online wellness coaching. So I provide personalized one-on-one care, customized exactly to your needs for people dealing with concussion. I also see people with stroke, Parkinson's, any of those types of conditions to help people with their recovery and just better condition management overall, and in finding good tools and management strategies for those folks.
Oh, yeah, awesome. Yeah, I did notice you have that YouTube channel, and it's great information. So, if you guys aren't already following, I'll include her handle at the end of at the show on the description. But yeah, follow her YouTube channel as well. Subscribe.
Yep, there is a lot of concussion information on the YouTube channel right now. And then I have some upcoming stroke informational videos as well as some other things that you'll have to stay tuned for. But yeah, hit the subscribe button. That way you're informed with everything that comes out. But for today, we are talking specifically about regaining movement after stroke.
Hmm.
And a lot of different types of things can happen after a stroke. So, depending on the severity of the stroke, where the stroke happens in the brain, we can have a myriad of different effects in the body, right? From weakness that impacts your movement. We can have issues in coordination or like the accuracy of movement. And then we can also have other issues like spasticity. And now, today, I also wanted to talk about maybe not movement directly, but maybe some additional things that can affect movement. For instance, thinking of things like pain, specifically in the shoulder. A lot of times, for people after a stroke, when their arm gets weak, their shoulder pain could be limiting their movement. Difficulty with sensation that can impact our movement a lot, and even certain types of strokes can cause motion sensitivity. So thinking of like bigger whole body movements, bending to put your shoes on. A lot of people will get motion sickness with that, and that could prohibit that type of movement. So I wanted to kind of speak on all of those types of things. And we have different types of stroke. As a lot of people know, we have ischemic stroke and we have hemorrhagic stroke. In fact, you said you had a hemorrhagic stroke, right?
Yeah, that's correct. Yeah, it was hemorrhagic. It was in the cerebellum.
Okay. So you
Yeah.
probably had a lot of more of the coordination type of issues, right?
Yeah, big time. Yeah, you're good.
Regardless of what types of movement impairments are present after a stroke, the good news is that we all have this innate ability for neuroplasticity and relearning in order to regain movement and recover after a stroke or a brain injury or any type of condition that affects the brain. With neuroplasticity, we can essentially learn to like rewire and remold the brain for those areas that were damaged. Now, with the stroke, whether it's ischemic or hemorrhagic, essentially the area where the stroke is occurring isn't getting proper oxygenated blood, whether it's a bleed or maybe the blood circulation is cut off from that area. Those nerve cells start to die off. So you're not getting the connection from the brain to the rest of the body for the area that's impacted. With neuroplasticity, we have a way to, if fostered correctly, we can rebuild connections, we can reroute connections or strengthen existing connections, or maybe strengthen other areas to help with the same job of the area that was damaged. So we have all these different ways. Um, so how do we allow for neuroplasticity? How can we rewire the brain essentially? There are different principles of neuroplasticity that I'll speak on. There are a lot of them, but I'll kind of speak on a lot of my favorites when it comes to rehab because that's what I do. Where I see a lot of people falling short in their exercise programs after stroke could be, I would say, repetition and intensity. So with repetition, think of relearning or think of learning a new language. You know how you have to have so much repetition to relearn like the vocabulary and things like that? The same is true for the brain with relearning movement. You have to do so many repetitions for that to become more rewired in the brain. Another principle is use it or lose it. A lot of people, they will, if their arm's weakened after a stroke, they'll have to use their other arm. And then all of the use of the other arm that's been weakened is pretty much fallen by the wayside, right? They're just relying on their stronger arm to do everything. So they're not using and engaging that impaired side in order to rebuild the connection back up here. You also need to use it and improve it. So being able to use that weaker side with intention, doing skilled tasks in order to improve the strength there. We also need specificity. So, you know, I can't work on sidestepping and expect to get stronger with standing up from a chair. You know what I mean? So you need to
Mhm.
practice the things that you want to work on. And you know, you want to keep working towards your goals. And my two favorite, I would say, are is working on intensity and salience. So intensity is where I see a lot of programs fall short. So a lot of people after a stroke they might do a few gentle exercises each day, which is an amazing thing, by the way, especially if they were sedentary before a stroke. They're not going to take on this huge exercise program that could be overwhelming and they might not stick to it.
Oh, yeah.
But having some professional guidance and working out to an intense level for their recovery can help drive that neuroplasticity. So that might look like going faster, adding more resistance to different things, doing consecutive exercises, thinking like a circuit, something to get your heart rate up, which includes increases the BDNF in the brain, the healing factors that circulate to promote neuroplasticity. So we have to exercise to a certain level in order to drive that recovery. So yeah, I would say with intensity, working with a rehab pro who's specifically skilled in stroke recovery is super, super helpful. Especially if you need that guidance, right? The general
For
population, like
sure.
we don't know how to just recover from a stroke. Like we didn't plan
Yeah,
on having a stroke in the first place. Like no one ever expects that, you know?
true.
And then the next thing that's super important, especially in my eyes, is salience. So that means the brain is more likely to change when working on a task that is meaningful for you. So exercises should be connected to your goals specifically. Walking to your garden, getting up from the floor for playing with your kids or your grandkids, being able to use your weaker arm to cook. Meaning fuels the motivation for the activities and it fuels the neuroplasticity. In fact, just yesterday I was working with a patient and she's recovering from stroke. For privacy, I'll call her Miss Susie, okay? So
Yeah.
I've been working with Miss Susie, and she has pretty poor standing tolerance. So we've been getting up to working on standing like 2 to 3 minutes at a time, giving her different tasks to do. And, her goal is to start living alone again because her daughter's staying with her and she's driving her nuts. Okay. So she
Yeah.
has her like eyes on the prize, like I need to be able to live alone. So some of the tasks that I've been giving her to get her to stand longer is like, okay, well let's put away the laundry. So I have her turn, grab something, turn the other way to place it over there. So we've been working on this. I've been doing different interactive and engaging tasks. I've been breaking out the blaze pods, like doing so many different things. Yesterday, I was like, we have to get you ready to throw down for Thanksgiving dinner. And she looked at me and little background, she throws down in the kitchen. Okay. That is her jam. And she is not shy about telling me that her daughter is the worst cook in the world and she has to deal with it. And she has so many opinions. And so when I mentioned Thanksgiving dinner, when I tell you she just like lit up, she's like, let's do this. And I'm thinking to myself, I was like, where has this spark been? Like, we're working towards your goals, but I feel like there's goals for needs and then there's goals for wants. And this like struck her want and she was jamming. I put probably like 30 different things on that table and she like grabbed all of them, turned, stepped, put them over, like she was ready to go.
Man,
So
I love that.
so that goes to show like you need to be motivated towards what you're working on. And that makes such a huge difference on it just like fueling you, but also for regaining the movement, right? You have
Yeah.
to practice and do it over and over again to rebuild the brain. So Miss Susie doesn't know it yet, but next week I'm breaking out the mixing bowls and we're gonna like hardcore do
Yeah.
Thanksgiving.
Yeah, maybe she's watching this live right now and she'll know.
She might be.
Yeah, you stated so many good things. I wanted to touch on the repetition, and I think that's so powerful because I remember it might be different for you, but repetition is so powerful because it could change, as you continue to do it, it gets easier. And for me, it got easier every year, so it changes. So I just wanted to touch on that too.
Yeah, so then when you do start to adapt to the amount of stress that you're putting on your body, it's just like regular exercise, right? You
Yeah.
adapt, you get stronger, and then it starts to become easy. Then you have to add the next layer of that intensity to make that task more challenging again for those repetitions.
Oh, I like that. Okay.
That way you're not like facing a plateau or just like you feeling like your progress is like really slowing down. You have to really keep pushing forward and finding that next level of challenge.
Oh, okay. Great.
And it can really be helpful to have, again, just someone skilled in stroke recovery to just really drive you on that journey.
Yeah, I could totally see that.
I also wanted to talk a bit about the different phases of recovery because
Mhm.
from early on in a stroke to a little bit later, and then more like farther down the line, different exercise interventions could be completely different, or I would say there are different priorities. Um, Meaning, so if someone had just recently have had a stroke, their priority early on might be just maybe learning to move safely with the different abilities that they might have, being able to position themselves and transfer safely, especially if they have like a flaccid arm. Your priority is protecting that arm so that it doesn't get injured, or especially if you don't have proper sensation anymore, you have to make sure that you're not getting injured with movement. um,
Mhm.
for someone who has a lot of spasticity, maybe early on they need to be working on their mobility so they don't, so they're preventing a contracture from happening too. And then just making sure that they are using their weaker side. My dad actually just had a stroke in May, and his stroke affected the basal ganglia, so he's having a lot of like coordination type of deficits, and it affected his dominant side. And I was on him in the hospital because he has enough movement to use like eating utensils, but out of frustration I kept looking over and he was using his left hand. I'm like, Dad, you have to use your right hand. It might be frustrating, but like, let's work on this, because like, let's hit the ground running and really make sure that you're reconnecting to that part of the brain and working on those synapses, because like, it matters. It
Yeah.
matters.
It's good to have someone like that, I mean, I'm guilty of that too, I use my dominant side or not the affected side, so it's easy to go towards that, the better side, yeah.
Yeah,
So
yeah,
it's
for
good, yeah.
sure. And then, later on, we'll call it like the intermediate phase, after a while, to where you're regaining some movement, you're working on regaining that voluntary control, you're improving your coordination, you're retraining like everyday functional tasks that you need to be able to do, as far as your exercise routine there. And then later on, maybe we're working on higher level balance or multitasking. We're working on rebuilding your endurance and your stamina to be able to progress towards everything that you need to do, and addressing any remaining like weakness deficits, with that higher level of challenge, like I was talking about. And just trying to return to your daily activities, maybe community activities or like your job duties, and being able to really train specifically for what those types of things may look like.
Okay, awesome. From your experience, are there a couple of things that you recommend to help with regaining movement, like specifically?
For like early on.
Yeah, yeah, that would be good. Yeah.
So I highly suggest finding a therapist, and that can be OT, PT. Um, Better to have both on board. And I'm not sure if you can speak to that with your experience, but finding those
Yeah.
professionals, that way you have that guidance to help, and it's not a guessing game, right? Because time matters. You're going to have the most recovery early on, so you might as well like work hard within that time period, get as much back as you can, and then still continue on to work on things after that. So I would say like finding someone um that is skilled for stroke recovery to work with would be my best advice. And if you have someone local, then that's awesome. If you need to do like some virtual online programming like I do, then you reach out to someone online. But there are a lot of great skilled providers that are ready to help you.
Yeah, I really like that. I think it helps speed it up. Like for me, it did having like a professional, someone who understands it and knows like what you're dealing with specifically. And so, yeah, it really helped me. I think Dr. Mersha Martin, I had her on in the past, and she was recommending that sometimes trying out different therapists before you actually, go with them to see if they're compatible with you also.
Yeah,
Yeah, so
because
yeah,
you
I like that.
because you're building a relationship with that therapist. Like you might be going in to see them, between 1 to 3 times a week, or maybe talking to them in between. So like you're in it with them. I know that I am for my patients. Like I'm in the
Yeah.
trenches with them, and we're working on this thing. So having someone that you click well with and that you feel like their approach meshes well with you, I think that that matters a lot.
Yeah, I love that. I really like your posts on Instagram. I think they're so fun and also it's just like very like energetic. I really connect with them.
Thank you. I appreciate it.
And someone asked, oh, it disappeared, but they asked what's your favorite childhood cartoon? Yeah, that's a good.
Childhood cartoon. Um, do. I'm gonna say childhood, probably the Rugrats.
Oh yeah, I like the Rugrats.
So I have a 2-year-old son, and we actually I we don't do like a ton of TV for him. Like we have very few like select things that we let him watch, like Curious George, like stuff like that. But I
Oh,
we
okay.
broke out the Rugrats one day, and there was just so much nostalgia. I can't even tell you.
Yeah. Hey, that's good you brought up that one. I can't keep up with the new ones nowadays. I think my friend mentioned some and I had no idea.
Great question. Great question.
Yeah.
The hard hitting ones, right? That's fun.
Yeah. Yeah, I think from another question I had, I don't know, I didn't know if you wanted to keep the questions at the end, but
Yeah, sure. Let's go.
I was thinking from your experience, like just with different patients, is there something that is most common that you see that keeps patients kind of plateauing or makes them plateau with regaining movement?
I will say that as I'm working in the clinic, something that I see very commonly and honestly breaks my heart is people who come to me finally after a year or two after their stroke, and they haven't done any type of rehab for their stroke, and it's kind of like starting from scratch, 1 or 2 years later, or maybe they don't, no one within their healthcare team recommended rehab, which is crazy, so crazy.
Yeah,
So that's something that I see, and it is really heartbreaking because they just haven't been getting movement. A lot of people they're living in their wheelchair and they're living in bed, and it plays such an emotional toll, and their story could be so different. Hindsight's 2020, so that's easy to say,
yeah,
but I wish that going forward that rehab will be recommended to everyone after a stroke. Like recovery is so possible, and you shouldn't have to settle for how you feel like right after an injury.
yeah. I'm so glad you shared that because I think that's so important. And it goes along with you were mentioning use it or lose it. If you're not using it, you're not actively trying to do things, and that's going to affect how your recovery goes.
Yeah, and then when you do start working on your recovery, it's okay, we have to rehab all of the deficits from the stroke, but we also have to rehab all of the weakness that is acquired from the last 2 years of laying in bed. And that is an uphill battle, because any
Yeah,
of us, if we're laying in bed for 2 years, like, we're gonna be extremely weak.
big time. Yeah. Yeah, it's like you do constantly have to challenge yourself. So I
Mhm.
love that. Thank you. Yeah, thank you so much, Dr. Arryn Gamble, for your time. Just make sure you're following her on her YouTube, her Instagram, her social media platform. She has a ton of information on there that's fun and also informative. Yeah, and so yeah, I appreciate you taking the time out to share your information with us. And what I'll do is I'll start cutting up the clips and I'll share it on the Instagram platform as well.
Fun. Thank you so much for having me. Thank you for just everything that you do for the stroke community and representing and just educating people and bringing information to the masses. I think that is so amazing, everything that you do.
Oh, thank you. Likewise. And, I think, I wish I would have had this information. So I'm glad that you can support that and provide as well. So thank you and have a good day, Dr. Aaron Gamble.
Thank you. You
Everyone
too.
said thank you. Yeah. Sleeper Hold. Thank you, Sleeper Hold and S. Smith. All right. Well, have a good day. I'll see you later, guys. Bye, doctor.
Bye.
Bye.